Well, joining us this morning is 7 Chief Health Editor Dr. Partha Nandi. And Dr. Nandi, we've been hearing about a second wave. Could this be the beginning of that wave?
Again, I think that it really may well be because, the numbers are going up and the temperatures are going down. And I think that unless we change something, we're going to continue on. So I'm a little afraid that this could be the beginning of a second wave. And here's the thing, and we were talking about this off air. The nice thing is we have the power to be able to change whatever that curve is. What we're seeing today is what happened 3 weeks ago, right? And now if we make those changes again now, which is what? That avoid social gatherings, indoors, if at all possible, and if you have to have them, make them small numbers, mask, social distance, disinfect. We have the power to change that.
And what are some of the factors that could be triggering an upward trend in new cases? Are people getting a little too relaxed on the issue?
Amir, I think a lot of things are happening, right? So I think 2 to 3 weeks ago, what happened? Schools began to get in session. So we had in-person schools where students are there and teachers are there. And young people, they may not be affected nearly as much as olders. Now, they can still get affected, but they can be effective carriers. So schools opening. Then as things get colder, people have indoor gatherings. They're not outside as much as they were in the summertime. And I think also there's this whole thing about fatigue. People are just like, I am sick of not doing this, that, and the other, and then they start relaxing. Maybe not wear the mask. Maybe think it's all over. That we're not going to do this anymore. And the last thing is that there are messages in the media from some of our leadership that that this is all nothing but an overblown scenario. It's just far from the case. So I think all those factors together are really leading up to us. Let's remember the last pandemic we had, right, over 100 years ago, the second wave was worse than the first wave. We can't let that happen this time.
All right, something that's on the minds of a lot of parents and a lot of families. Halloween is 2 weekends away, and there are a lot of outdoor events starting as early as this weekend. How should parents factor this increase in cases as to whether or not they should go trick-or-treating? How should they consider this?
Listen, for my family, we're not going trick-or-treating. We're just saying, listen, it's 1 year, right? This is not your lifetime. It's 1 year. We're going to have a lot of fun at home. We're going to dress up, etc. So what I would say is take into consideration that you don't know what others are doing, right? You don't know if others are really doing everything that you're doing in your family. So why take that added risk? I just did a story on 7 just a few days ago that now in Australia, they're finding the virus 28 days on non-porous surfaces. So for all those reasons, I think we should try to limit those gatherings as much as possible. And thinking ahead to Thanksgiving, I would limit some of those gatherings, do virtual gatherings. You can have a meal, have Zoom or FaceTime and talk with people. I just think we have to be careful. It's 1 year. Let's get past this virus. Let's control it and not let this take over our lives again.
All right, very sobering words, a sobering warning, Dr. Nandi. Thank you so much.
My pleasure.